Xenotransplantation is the transfer of animal organs or tissues into the human body. In 1963 and 1964, Dr. Thomas Starzl performed 6 xenotransplantations of baboon kidneys into humans. Survival rates among the patients ranged from 19 days to 98 days. In 1984, baby Faye was born. She suffered an inevitably fatal condition of hypoplastic left heart syndrome, an underdeveloped left side of the heart. Doctors quickly determined that all was lost unless they attempted an emergency heart transplant from an infant baboon to Faye. After gaining permission and even after Faye was required to be placed on a respirator after heart failure, on October 26 in Loma Linda University Medical Center in California, Dr. Leonard Bailey placed the baboon heart into baby Faye's chest during the critical 4-hour surgery. Following their operation, Faye was observed as doing well for a few days. However, a massive attack on the foreign tissue of the baboon heart ensued, resulting in Faye's death.
The problem with xenotransplantation is that some people may not find the insertion of animal organs or tissues into the human body to be ethical. Some may believe that if the procedure was perfected, that it could save many lives. But at the same time, animal rights activists may not believe that it is necessary to kill off, say, baboons or pigs in order to save human lives. In 1992 and 1993, Dr. Starzl oversaw the transplantation of 2 baboon livers into 2 different male patients, whose names were withheld. The liver transplants were performed because the patients suffered from hepatitis B, and the human organ transplant would surely fail because the disease would simply destroy the new organ. Baboons are naturally resilient to hepatitis B, and thus were thought to be ideal donor for these special candidates. The first patient, a 35-year-old male, survived for 26 days, and the second survived for 70 days, both eventually succumbing to the effects of taking too many immunosuppressants. There was also some data pointing to inadequate function of the liver, but the possibility remained that animal organs could function in humans for extended periods of time. Xenotransplantation could be very helpful by lowering medical costs. It is estimated that the cost of treatment for heart failure patients ranges from $8 to $35 billion per year. The Center for Disease Control reported in 1996 that heart failure kills 4 times as many people as an HIV infection. A xenotransplantation procedure is carried out by a doctor, veterinarian, and various infectious agent specialists. I personally do not believe that xenotransplantation should be implemented because for many people, heart failure or liver failure is just due to the lifestyle that they live, and it's not something that they tried to prevent or is something that comes about naturally. As well as the fact that there's no evidence that xenotransplantation is a viable solution in the long term because the patients don't end up surviving for very long.
I do not think that xenotransplantation should be a use to treat different diseases because I don't think it is ethically right to kill animals such as this little guy right here just to help out people who made their own dumb mistake and caused diseases such as heart disease, which in most cases is not caused by something that is through genes. It's usually by someone using or making decisions that are not smart, such as eating terrible food or not exercising. So I do not think it's right to kill an animal, even if it's not a dog if it's a pig or a baboon, and I feel like it's not right religiously or ethically to do that.